Hi everyone, this is Ginger here. I am immediately post-op by a few hours from a partial mastectomy. And I just wanted to share a few things with you. For those of you fellow women out there who've been through the same thing, as a PT, I have a slightly different experience. And so I've got my little fancy binder on here, and the pain is well under control. So I always encourage you to stay ahead of the pain. You don't want the pain to increase and then be, in an unmanageable state for sure. And stay on top of the nausea as well, drinking lots of fluids. So I've been doing all of that today and resting, and my family is here to support me and take good care of me. What I am going to start doing, and you have to talk to your surgeon if it's right for you, but I just want women out there to know that the tendency may be to just protect and pull the arm in and not move. But I encourage you to do several things, as you're getting enough fiber and hydration, that you're taking some walks, hold somebody's arm if you need to. I know I feel a little dizzy and off today because exercise is going to promote that, that movement that you need for digestion, right? Because nobody likes to be all stopped up after surgery, and that's pretty common. The anti-nausea meds, the pain meds you get, the anesthesia all act as to stop digestion really and cause constipation. So those are some things you can do to keep moving, but to keep digestion moving. But the other thing I wanted to share with you is pain management techniques. So maybe you don't have to take stronger pain relievers or opioids. And I'm trying to avoid that. Obviously, if I need them, I'm going to stay out of the pain. But so far, Tylenol is working. But I'm also doing some yogic breathing to help with pain management. And on this side, some of the mass that was removed had gotten into the pectoralis and some of the surrounding muscles. So those are involved as well. So I'm going to have to do some therapy, right? So one of the first things you can do is there are really inexpensive pulley systems you can put over a door, right? And that little pulley, I'll show you in my next video, to what's called actively range that arm in an assisted way, right? Active assistive range of motion. So one thing I've been doing today is wall walking, even at post-op day 1, because the incision, I don't want the scarring to give me a shoulder issue, right? So you can wall walk to your limit. It's pretty sore. And then slide it back down. You can do that several times so that you don't end up with a shoulder issue on top of, the breast issue and surgery as well. So let it slide. The other thing you can do while resting in bed, you can use a stick or part of a broomstick or a dowel rod. If you feel comfortable with it, you can use your own hand. Take your hand and raise that affected arm to your limit. And breathe. You can do what's called Ujjayi breath. Inhale, and Ujjayi breath is called victorious breath. That's what we need right now, right? It's a little bit more noisy of a breath. You can see my muscles sticking out on the side of my neck, just on the one side. We shouldn't be able to really see that, but right now, with pain and soreness, you're probably going to see the neck muscles try to help out. Can you see that? Just on that one side. But the more I do it, the less sore it is. And the less likely I'm going to have, I'm modeling that scar tissue to line that up. And of course, if we have sutures or glue or whatnot, we want to be careful with that, not to open that or irritate it at all. So you're only doing it within the limits of what is comfortable. And then I can also support my arm like I'm going to throw a ball and reach back, because that's going to stretch that scar under your arm as well, if that's where your scar is. So all those are all the ranges of motion, including touching the other shoulder. And back, you can use the wall to support you to do what's called a little wall stretch. That's probably the most tender one right now. It's tugging on that incision. Make it nice and easy. Okay, not overdoing it, not aggravating the incision, sutures, or the glue, whatever they're using at all. These are some of the things that you can do to help with pain management and also preventing having shoulder issues, because it takes some time to heal. One last thing, when you're breathing, make sure you're not chest breathing. You don't want to breathe up here, okay? And you want to breathe through your nose, and you want to shoot for about, if you can, 4 to 6 breaths per minute. 4 to 6 breaths per minute. So exhaling out for a count of 4 to 6, preferably 6 if you can. Inhaling to 6. No chest breathing, no muscles sticking out. Exhaling for 6. Inhaling for 6. If you're breathing that way, that is really going to help with pain and anxiety of what's happened, because surgery is a trauma in itself. You can also use the breath to help the skin and the fascia and the muscle relax and get a little bit of a stretch too. Okay? I hope that helps you out. Maybe tamps down some of that anxiety or fear that you have if you've just had a lumpectomy or a partial mastectomy. Mine was a little bigger. It wasn't just a small spot, so I have a bigger incision. And my support goes out to all of you who are going through this, and I hope this was of some help to you. I'll see you next time.